reason why I chose neurology goes back in my childhood too. My father suffers from spondylolithiasis and spondylitis actually, which is an inflammation of some of your vertebral discs. And I saw him in pain all my life when I was young. One of my best friends suffered a horrible car accident, and he's a paraplegic now from the waist down. Ever since then, I've been exposed to it all my life. And in medical school, neurology is like it's a different language in medicine, and anybody will tell you that. It's either you get it or you don't. It's either you like it or you don't like it. I just got it and I loved it, and I went with it, and here I am. I couldn't be happier. Make sure you go to someone who has a history of taking care of their patients, teaching their patients. It's the most important thing. As doctors, I feel that we are interpreters. We are mere interpreters of a book that we read, and we're interpreting what we have read and telling you what's going on. That is our job. I'm happy with the way that my patients come back to me and tell me, they refer patients to me all the time. And it's because I spend the time to teach my patients what's going on. Some of the bigger things is migraines, number one, numbness and tingling all over the place. If I'm in the hospital for hospital consultations, my biggest ones are strokes, altered mental status, whether it be on the general unit or in the ICU unit. So if you're having any neurological symptoms like migraines, tingling, numbness, the first thing to do is come see us. I would come and evaluate you. I would get a history. The history would entail anything of what's going on, the present illness. I would also obtain a past medical history just to see if anything in the past is causing your symptoms now. We can do a family history as well to look for any causes in your family that could be genetics, social history, illicit drug use, alcohol use. These are all things that can cause symptoms. Once I go through that, I'll do a full examination on you, fully focused neurological examination. With all of that, you take it and you kind of piece on, okay, you offer a differential diagnosis as to what this could be. I'm not a drug pusher. I don't like pushing medications. If I can reverse something that you're doing at home that's causing this, then let's do it. My goal is to make sure that I take care of you and you don't have to come back and see me. There are diagnostics involved. Each complaint has a different diagnostic modality. For example, migraines, the first time migraine you're having, and if you're a certain age, if you're 55 or above, I would get some head imaging on you just to make sure there's no structural abnormality that we would need to be worried about. For paresthesias, numbness, tingling, I would get a nerve conduction study on you, which is an electrical study measuring electrical conduction in your nerves. Those are the two biggest studies that we have right now. For seizures as well, we do EEGs, where we check electrical brainwave activity, make sure everything's functioning accordingly. So those are the three biggest ones for us. So the advantages of being in a multi-specialty clinic like this, majority of doctors are under one roof. So if I need something where I need internal medicine's help, I can literally open the door and consult one of my doctors right outside. I don't have to wait for the patient to go see a doctor. You know, we have OBGYN here. I know we have rheumatology here. I've worked with rheumatology hand in hand, probably on a daily basis, and it's nice just to sit there and get answers quickly. You don't have to wait. That's the beautiful part of a multi-specialty clinic.